The Ehlers-Danlos syndromes are diagnosed based on a set of diagnostic criteria that were put forth in 2017. There are 13 different types of Ehlers-Danlos syndrome, and we can make a diagnosis for 12 of those types based on genetic testing. And the 13th type, which is the most common type of EDS, the hypermobile type of EDS, relies on the clinical diagnostic criteria because we do not yet have a genetic test to offer for the hypermobile type of EDS. The hypermobility spectrum disorders are diagnosed based on the presence of hypermobility, which is symptomatic, in other words, causing chronic pain or causing instability in the joints, leading to dislocations or subluxations of the joints, but without meeting the diagnostic criteria for any of the types of Ehlers-Danlos syndrome or any of the other hereditary disorders of connective tissue which may cause joint hypermobility. So what the Ehlers-Danlos syndromes and hypermobility spectrum disorders have in common is the joint hypermobility, and there are also common what we call comorbidities or medical concerns that seem to travel with EDS and HSD, including chronic pain, problems with the autonomic nervous system, mast cell activation, gastrointestinal complications, and many others. And it is very important to remember that these medical concerns must be addressed regardless of the diagnosis and to optimize the quality of life for the individual regardless of what their diagnosis may be.